I'm sorry, just. Video. One second. Yeah, I was just eating what I heard. No, obviously when you send stuff at 4 o'clock.
Yeah. We tried to send it, but it wasn't. Acting up. There's a large file.
If it's the internet. I think we're ready.
Kicks it back.
Or like the little boys were calling. They either. Yes, we are ready. Okay, yeah, we're ready. Yeah.
Okay, we're gonna go ahead and get started. Excuse me, we're gonna go ahead and get started. So our foundation meeting. Roll call please.
Director Smith. Here. Director Rogers.
Here.
Director Teresa. Here. Director Lawson. Secretary Delara.
Here.
Vice President Rodriguez.
Here.
President Barraza.
Thank you. Item B, approval of the agenda.
So moved.
Second. All those in favor say aye.
Aye.
There's no opposition, agenda been approved. C, public comment, at this time, the audience may be made on items not listed on the agenda that are of public interest and within the subject matter jurisdiction of the district. The board has a policy of limiting speakers to no more than 2 minutes. The board cannot take action on items that are listed on the agenda. Public input may be offered on agenda items when they come up for discussion and or action. Any public comment?
No public comment.
Thank you. Item D, consent agenda. Any questions, anything that needs to be pulled? If not, I'll entertain a motion.
So moved.
Second. Okay, there's some money involved, so we're gonna go ahead and take a roll call vote.
Director Smith.
Yes.
Director Rogers. Director Perez Gill. Yes. Director Loxton.
Yes.
Secretary Delara.
Yes.
Vice President Rodriguez.
Yes.
President Barraza.
Yes, thank you. Next item, E, reports, campaign and initiatives. A, PPMG Health Mobile Medical Clinic operations.
Yeah, well, Andrea is pulling the video up that Sergio did a wonderful job putting together some of the pictures that we took at the event this last Saturday at Esperanza Park. Esperanza Park is the newest park in the city of Quito City. Donna and I were crucial in the meetings leading up to this development of this park. That's where we met Yvette Perez Gill and her brother Mario Jimenez, who sits on the Quito City Parks and Recreation Commission. So this event was the first event that we hosted ourselves in partnership with the city and the Desert Recreation District that now operates the parks within Cathedral City. So it was very exciting for us to partner with them. And some of the things that we were able to provide on site is we had our vision clinic, we had our women wellness clinic. Unfortunately, BPMG Health couldn't be there that day, but we reached out to St. John's and they were able to do the pap smears for us. Some of the numbers from the event, we had approximately 125 community residents participate in the health fair. We did 33 mammograms, 15 pap smears. We had 60 eye exams with 54 pairs of glasses produced on-site, custom made for those individuals. We distributed 200 of those medically tailored food boxes where we provided that $500,000 grant to find food banks. So they brought some of those medically food tailored boxes out to the event and they brought 200 and distributed all 200 of those boxes. Aside from the medical mobile clinics that we had out there, we also had 20 community agencies that did tabling. Those were from county entities to nonprofit. So that was out there providing information about with the red cars and everything that is happening with the ICE. Raids that are also very prominent in Cathedral City these last couple of months. So it was really great to see all of these different community partners kind of come together and showcase the beautiful park there in the Dream Homes area that is less than a year old, and it's just a really nice facility. A lot of the folks that came that were even from Cathedral City said, wow, we didn't even know this park this year. We even had folks that were riding on CB Link that kind of saw the commotion, kind of rolled in and said, hey, what's going on? So that was part of the work that we did. Marketing, we were able to partner with the City of Cathedral City Public Information Officer and also the Public Information Officer of the Desert Recreation District, who were able to kind of spread the word amongst their different channels, and obviously all of the different participating entities that were there tabling, they also shared the flyer. We also shared the flyer with the Palm Springs Unified School District that sent it out to all of the Cathedral City schools, and we made physical flyers that were handed out during the fine food bag distribution that happens out of Agua Caliente Elementary, which is right next to the park. So just a couple of pictures. I don't know if the quality might be a little bit.
This looks big.
Yeah, so but we could just play it, just some. So, thank you, and as part of that too, you saw some students there wearing those green scarves, so now we have volunteers, we have connected with the Coachella Valley High School Health Academy. So at every event now that we have where we deploy our mobile units, we have support from the Health Academy with Mr. Simon there. And the Peña Flor, they come out with 6 or 8 or 12 students, depending on how much support we need, and also the COD nursing students come out and support us. So now we are getting some additional help at these events. So hopefully this is not the first, this is the first one. And we hope to replicate this, throughout the Coachella Valley, where we will bring out, as Donna, when we started discussing this, as she mentioned, just kind of bringing the caravan out of these mobile units and then bringing out all of these different, supportive services from all of our nonprofits, governmental entities that are able to share information of what resources they have. So the first one, so hopefully we get to replicate it a couple more times. And we're very excited, and thank you to the board members that participated, and they got the tour of the Vision mobile unit as well.
That's very beautiful.
That's very impressive. Thank you. Any comments, questions from the board?
Me? No, because it was in my area. I heard back from a lot of the community, they were very excited. They were happy because a lot of the resources that they got that day, they didn't even know that existed. So they were very excited. One thing that I was thinking about, that I wanted to kind of mention, because my father and I, we did go door to door giving flyers in the neighborhood. So I think that maybe that's another component of when we do these house fairs, that we might need like at least 1 or 2 promotoras to go out in the area so that we can make sure that more people are aware. and actually attend it, because I think that's kind of a thing that kind of made it a little different, cause we did have like the internet and all that. But we posted flyers at the liquor store that was there, we posted flyers at other liquor stores, we went door to door, we did word to mouth. And I think that's part of the reason why we had the outcome that we did, because everybody was aware. And it would be nice to see it happen again somewhere else, you know, the same way, cause that's the ultimate purpose, to make sure that people come out and get the services that they don't, you know, that they can't get. And if we can maximize on that, it would be good. I was surprised with the eyeglass case, how they do the glasses and everything. It was really nice, everybody was happy, the city hall was happy, the council members had to tell you thank you. And I know it was an effort from everybody, cause everybody, you know, the whole staff works on it, like Will's in charge of the media, Anna's in charge of the outreach. Donna's in the helping with the with the nonprofits, helping with like, you know, associate, you know, everybody, you know, out there, the nonprofit. And then Andrea puts everything in the back, the logistics, everything that she needs. So I appreciate you guys all, because this was something that was really close to my heart, because I worked on the initial, you know, the initiative, and having it come out, having it come out the way it did, it really,
Thank you, and thank you for doing that outreach on the ground. I think that that's a, you know. You went at that extra mile, and it really does make a difference, because as much as we're all connected on our phones, sometimes we'll see something in the event and like. We don't know, right, like sometimes just misinformation or just seeing it, like it doesn't, we sometimes don't connect to the actual event. We're like, oh, I do wanna go, sometimes like, oh, I'm shy, like what if they charge me for something, or what if it's not completely free? And so I think having that connection, especially from a neighbor, cause it's, you know, as a resident, that same city, I think it really does make a difference, it really did make a difference.
and that's what I like to do, so for me, it's like nothing, it's not even like.
So we're the next one.
Yeah. Let me know.
I just wanna say thank you also, it is very sad when you put an event like this together and you have all of the providers there, the services, and that people are afraid, or that people do not know of it. I attended an event last year, it was at Desert Highlands there. And it was indoors, and there was all of these providers, and it was just sad to see there was less than 5 people there. So congratulations.
I was afraid too,
Yeah.
that day I was like, oh my god, are we gonna have people, cause I know that happens, you know? But when Alejandro said the number, I was like, oh my god.
Did you have food trucks there?
No, it was just just like the people that came out and then the.
Yeah, what strategies that we implemented to ensure that each of the vendors there had a visit from each of the participants is that we created a passport. So the passport, you know, is a little booklet that had, you know, their name, and in order for them to qualify for the opportunity drawing, they had to visit each of the booths. And we purchased little stamps for each of the vendors that we handed to them. And each of the, it almost looked like a bingo card, but with the organizational logos inside of each little square. So as the, you know, community member approached and they heard about the services that the vendors were providing, they went ahead and stamped it, and then as soon as they completed, you know, visiting all of the vendors, we took that passport and then we gave them a raffle tickets. So that really ensured that not only, you know, were the vendors busy, but also our whole unit, so it worked out really well. And that's how we were able to get from 125.
And everybody was excited, all the little kids were all excited when the raffle was coming up, even the adults, they were making like this big of a deal, they were like, oh, hopefully I get the air fryer, hopefully I get the bag, they were excited. It was nice.
Yeah, the only problem was lack of parking,
Yes.
so I mean, that's the problem with the park at this location, it's right in the middle of everybody's homes.
Yeah.
So, you know,
It's the parking,
I'm glad that you went out, yeah, I'm glad that you went out to the neighbors to let them know, you know, that was a lot, because the parking is scarce.
It was.
Director Smith, and then we'll go with Director Mike.
So great work. I love this type of stuff. So this is good. And I'm sorry I couldn't be there. Cause I was out of town. I do have two questions, as far as location of the clinics. So I think I saw on here and I keep scrolling past it, but, the locations are determined by demonstrated need. So I'm just curious, like demonstrated, how are we determining? How do we determine where the clinics will be held?
That's done by the medically underserved areas.
Okay.
That's how we determine it through the care on report. And then, working with, goes back from our COVID days when we were strategically kind of doing some of this pop-up clinics because we saw that the need was in certain communities. But now, we try to be everywhere. Part of our locations, we try to be in all, 9 cities, ensure that we're equitable, and that's why we. One weekend we'll be out in Mecca, and the next weekend we were in Cathedral City, we have another one planned. In Palm Springs, Palm Desert, so we try to go around, so the next women's wellness clinic. Is actually gonna be in Palm Desert, we have a California Care Force event this weekend, where we will be part of that. So we try to strategically go throughout the.
Do you have a published schedule?
We're working on that, I just received the dates for the fall, because we take a break during the summertime for the generators. From those mobile units will go out during the summertime, try to keep up the energy and all of that. And they told me that they do have hardwired, but it's a 250 volt connection that nobody has, but we do have that, and we're working on actually establishing a web page, a tab on our website, where we'll actually have an events calendar and actually even have registration forms. And that they could download the intake forms, so to expedite the process when they show up to the clinic, they already will show up already with their intake completed. So that could also speed up the process, so then we could become more efficient and see more patients instead of being bogged down by them filling out the application. They could download it, complete it, and show up to the clinic already with the forms completed. So that could expedite the process, so we could see more people, because we'll be more efficient.
DPMG schedule published somewhere?
We will have it now that we have, their new contract out, so we'll have that, we'll have that,
No, I think that's really good, and I'm happy that Palm Desert will be in there somewhere, because I know when we used to do our clinic, we would park it over at I guess now Wellspring Church, and you might say, oh, this is Indian Wells / Palm Desert, well, it's gonna come. So, but when we did food distribution and the rest of it, that line was always down, really far, because people were coming from other areas if they missed, maybe another event. So that's great. And my second question is, so I see, and I understand the reason why that for the women's health, but I do wonder, and it's because of an experience I had over the weekend. I was with a family member walking through the parade in Oakland, and a gentleman stopped us, and he said, oh, well, we'll give you, talking to my family member, $50, so you can do a blood test. I think that I heard for colon cancer. That's right, something having to do, okay, colon cancer. And I thought that's really interesting, particularly targeted toward communities of color, where very often men are not getting those type of treatments or seeking that kind of help. So I do wonder, are there any type of services like these being offered for men?
We are in the process of that, and we actually discussed that this morning with, in our staff meeting of developing a men's wellness clinic. Because if we take the same strategy of doing mammograms and pap smears very upfront, there's a stigma associated with, with some of the tests that, like prostate exams and colonoscopies. So for us, I think we're just gonna market it as a men's wellness clinic, and once they're inside the mobile units, that's where those conversations will happen. That's where.
And you get them.
That's what we get them. So it kind of reduces the stigma, so that the men could actually come out, and we'll have the same thing with the incentives and, take them out the road. But that's a conversation that we've had with DPMG Health, with how we could actually incorporate some of these, men-specific clinics, because, some of the growers have been asking about that. Hey, you're doing mammograms, pap smears, but our whole workforce are primarily men. What can we do for them outside of primary care? Your blood pressure checks, your blood glucose checks. Now we want to go into specialized clinics, and I think that's a natural evolution of our mobile healthcare initiative that we started off with primary care, And now we're evolving into specialty care with our mammograms and pap smears and our vision clinics.
Thank you.
Director Gloster?
Yeah, couple comments. One is, do you have a demographic data on who's coming?
We do, yes,
Do you collect contact info?
we do.
Are we planning to have repeat clinics in the same location again, so people can begin to expect follow-up in that location?
We do, as part of the registration process that we do online or via telephone when. A community member is not comfortable utilizing our QR codes, we do have Celine. Cell phone as a landline, so she's the one that gets that information, calls the community member back. And has them registered through the system. So, when working with Megan, we were able to establish some basic, demographic data collection up front. And then as part of the clinics, we also have a satisfaction survey that asks a series of questions, when was the last time you had your pap smear, when was the last time you had a mammogram? If you didn't get it done here at this clinic, what was the likelihood of you, getting it to your primary care provider? Are you insured, are you uninsured? So we ask a series of questions, and here in the next couple of months, we'll have enough data to kind of put together an infographic to share with the board.
Good, and so if somebody that came and got their pap smear and needs follow-up in 6 months, can she expect to go to Esperanza Park again? And see the doctor there again? Or does she need to try to find a primary care to follow up?
Hopefully the primary care, because obviously there might be additional needs that the individual might have. But we do have each of the attendance rosters. And we know when they're due. That was one of the conversations that we had with Melanie from the Pink Turning Foundation. She reminded, hey Alejandro, we're already a year into this, we need to call the women from the last.
I would like to
last
see
year.
that, I think that's getting to my final point.
Yes.
I would like to see. Somebody on the team, staff, stuff to do those follow-up calls. Have you seen another provider that you weren't seeing from before? Now, since you've seen us or not? Cause I wanna know if this is their primary mode of care delivery, because at least in my district at the listening session. Nobody can get into primary care, they're 3 to 6 months out, specialty care, I think is about 6 months. For, the kind of primary specialty care, and so it's just, I would be interested to know if. What we're finding something, we're following these people up, if they're actually able to get into a clinic, because what we heard was that everybody, and I see it, we see it every day, everybody's using the emergency room. Same thing why Desert Regional is slammed right now is there's no primary care access, so if you have a problem, you can't just call somebody and say, let me come to your office. You have to go to the ER to get seen, so we're the urgent care. Yeah, but urgent cares they're fine, but most of the time, if there's anything at all wrong with you, you go to the ER. That's why, again, it comes back to our point about. Secondary ERs we wanna open up where you can deliver care, the urgent care outside of testing and diagnosing you can't really do anything for you. Might give you a prescription for antibiotics, which is very basic, but outside of that, most of the time we get referrals in from urgent care constantly, then they close at 5 p.m. So my whole point was, let's really, again, focus on that data you're collecting, because I think that's gonna answer a lot of questions about how we wanna participate in being deliverers of care.
Yeah, and that's part of the reason now that, I made a petition to Chris to move Belen from part-time to full-time status, because that's her sole role now. Is calling the women after they actually participate in an event, that, hey, how you received your results? Do you have any questions about your results? Do you have a primary care physician? Can we connect you to one? So that's part of the follow-up, as you heard from Claudia, who gave her personal testimony at our last board meeting. That's the kind of women that we're finding that really don't know, hey, I haven't received it, or I don't know what does this mean, or how do I make an appointment to go get an ultrasound, to get a biopsy? So that's Belen's role now, is to call all of the participants from our mobile clinics for the women wellness to ensure that they're actually getting connected. If not, then we welcome them back to one of the events. It might not be in the same location, but it will be in the same city.
Yeah, we should think about same location, seriously, make it a primary stop point for people, just like a bus stop. Oh, clinic's gonna be here on the 7th Thursday, something like that. Another point is, in terms of you're talking about people getting forms and access, have we thought about? I don't wanna use the word patient portal because we're not a patient, but is there an opportunity for us to open up something that they can actually log into to have their information with us? Here's their forms they filled out last time. Here's their visit that they can. The patient portals are very cheap to purchase, very cheap to run. They're all HIPAA secured, but it's a way to kind of, and I don't know how TPMG is doing it. because we don't fill out medical information here at this
On
meeting.
my chart.
They're on, well, or they're on Cerner. I don't think they're on Epic, are they? I think they're on Cerner, which is at least how that's a regional. So it would be interesting, are these people getting access to that or not? Because you wanna have a way to really reach out and contact these people. We're not gonna be delivering necessary medical care for there. But having a place where they get comfortable logging back to check in, to see where it is, book their appointment online. You know, those, I just set up another portal for another healthcare clinic. It was really easy to do, and it answers a lot of the questions that and then you can send out mass text to the group. You can email through that, you can tag the patients with who needs to follow up at which clinic. I think looking at that into the future is gonna, especially because now you expend them in, is gonna make a big difference.
And I think that will be aligned with our strategic plan,
Okay.
see, right, like what.
I think so, and I think, yes.
And I think too, we have to consider here where we're talking HIPAA related tasks, so if this is crossing over into district staff. I'll wait till they're done. If we're crossing over into district staff doing this, then we have to be concerned with HIPAA requirements.
Of course.
Versus, the DPMG health staff.
I wouldn't put necessarily medical information on there, I would put more of a demographic contact, informative, it's, you don't have to collect medical information there, but you collect contact, appointments, scheduling, all that stuff can happen on there. At least in terms of awareness of where the clinics are gonna be, because I wanna see that woman that you saw, at Esperance Park, I wanna see her back in 6 months. Because really, healthcare is not just this one, like, stop in, stop out. It's a longitudinal, like, hey, you're gonna be our patient for life, and that's where you really see the health benefits of delivering medical care. It's not these come in when you have a problem, leave, it's that continuity of care that doesn't really exist.
But I think you almost have to know what their medical history is, what they would need.
Well, they just checked in, and you got checked in at this clinic, and came and saw you have an appointment, if you wanna come again, we can contact you here, you can say, hey, I'm gonna see them at Esperanza Park, here's the schedule. Click, I'll take an appointment.
I've seen so many, I'm sure that you're familiar with some sort of like these programs, like I know the legislature has a constituent database where you can send out mass communication through there and send out public.
Yeah.
So I'm sure there's something.
But then you can send
So we utilize Calendly for our appointments. So then I'm able to go on the back end and download, Excel files with all the phone numbers. That's what we have all the demographic data.
You have the start of it.
Exactly, so we already have an Insurgent takes that and we contract with a text messaging service that actually sends out a text messages, hey. Guadalupe, you have your appointment, and I set up the increments for them to get a text message. A day before their appointment, 6 hours before their appointment, and 1 hour before their appointment. So they're constantly getting communication, and it also gives them an option to cancel the appointment, so then. Because we typically will have like a waiting list, we could say, okay, somebody canceled then, but then we'll call whoever is number one on the waiting list and say, hey, we have an opening for you. Can you come in at this time? So we do have the foundation of
Yeah,
it.
that's good.
And we're able to kind of use technology to kind of help out push out some of that information. But I do like the patient, and I think that's where we're kind of, hopefully.
You're brainstorming around it.
We're brainstorming around it to kind of put everything in this tab, from the calendar, from downloading, from booking appointments on there. So
Schedule, where we're gonna be, when we're gonna be, who's gonna be there. And then I think it comes to a bigger point for us as a whole is, we talk about we wanna deliver care, and the second thing is, who's needing to discuss the level that we wanna take these clinical clinics. I mean, we started small, which is great, but I don't know who's involved in providing screening guidelines, or I know DPFG is probably helping to some extent, but do we have a vision outlook, or do you have a strategic plan specifically for the mobile clinics that you would present to us? Cause I know I hear we keep adding things on, but I don't see the vision casted out in front of me, I don't know if that's, go ahead.
Well, but I think what we've been doing is, because mobile clinics are going to be a part of our bigger strategic plan.
Right.
So I think we've been waiting, in a sense, to develop a growth plan for the strategic, or for the mobile clinic based on the strategic plan. So once we get the communication from the board that, hey, this is where we're going, that's what we're gonna continue to do from our broader strategic plan, then absolutely what you're talking about.
I see, yeah.
Needs to develop.
That's right, okay.
Johnny, you had something, right? I apologize, I think.
The ultimate goal is to get the patients insured, so through their insurance companies, they have portals. One of the things we could offer is health literacy, how do you get around your insurance companies, how do you deal with them? With the portals, they make your schedules and make your charts and everything else, so. That's the ultimate goal, is to get them insured, so they're not going to the emergency room, they're going to the insurance.
There's just nobody to take care of now on Medicaid, that's my biggest issue, I'd love to get them all insured. I don't know who sells
Some
them,
are not gonna get insured.
they just, well, or they get insured and they can't get it, go ahead, sorry.
Yeah, part of the, to add to Donna's comment, part of the process too is that with DPMG Health now, since they have partnered with St. John's Clinic in Indio. And they have a brick and mortar here right across the street, anytime that we see a patient on the west side of the valley. That needs follow-up care, they get referred to the DPMG Health brick and mortar here in Palm Springs. Anytime that we see somebody on the east end of the valley. You know, we make a referral to St. John's, so that St. John's is able to actually, become their primary care, physician. And they do have enrollment specialists there, that enroll them into Medi-Cal. Or like this Saturday, they were enrolling the women into the Family Pack program. The women that were uninsured, so they could qualify for the pap smear, so we kind of not just provide the service, but we also have.
Yep.
Supportive, services that help them enroll, into, different programs in order for them to continue their treatment, because we don't see, at least I don't see the mobile clinics as their medical home, it's an entry point into the larger healthcare system. We see them once and they say, yeah, let's get them referred, if they haven't been connected, then we surely welcome them back to our mobile clinics, but our goal is to get them into a primary care, physician, so they could continue their care thereafter.
Thank you, so we're
So,
going to
Madam
move on to
President, I just wanted to follow up to get an understanding of what you just said. Our goal is to get him into a primary care service. So it's not necessarily St. John's, it's any of the, so do we have information on DAP and Intercare and the county as well as St. John's?
We haven't, just because Dr. Kim operates out of St. John's, so she's able to see patients there at St. John's. Have we referred to DAP and Intercare? Yes, when they have appointments available. Right now, St. John's tends to be the federally qualified health center that is accepting new patients without them having to wait, just like we heard.
The county will accept new patients at any time too, so that should be.
What was that you said, John?
He said the county will.
County will accept patients.
Yeah, that's what I'm just wondering, if, to make sure that whichever one they can see first, to give information on all of them.
perfect, thank you. Next item, Pete Journey Foundation, Women's Wellness Clinic.
Yeah, it goes with this, but yeah, Spring Journey Foundation is just phenomenal. We are gonna be hosting, we have new conversations with California Care Force, which is a large pop-up clinic that happens once a year in Indio. At the Empire Polo Grounds will be implementing something new that they haven't done and they've been wanting to do for a very long time, is to do a women's clinic. Obviously, because of the facility there is a big warehouse, one of the big tents where Coachella happens. Privacy has always been a concern, especially when you're doing a mammogram and a pap smear, but now that we have incorporated our 2 or 3 mobile units, the Pink Journey Foundation and both of our mobile units. Now, for this year, Friday and Saturday, we will be at the California Care Force providing pap smears and mammograms for them both on Friday and Saturday. So that's an event that video, and then our next event after that will be at the Rap Foundation building, where once again we'll do the Women Wellness Clinic with the Pink Journey Foundation, providing pap smears and the mammogram. So we continue our work. This is only our 5th event, I believe, out of the 19 that we contracted with the Pink Journey Foundation. So we got a long way to go.
Thank you. Any board member comments? Questions? No? Thank you. We're gonna go ahead and move on to committee meetings. 1, finance, legal. Administration, real estate, Director Lobson.
No real.
Report.
No real comments there, the agenda is there.
Any questions on that? No, all right, next item, for the committee meeting, there was, no meeting due to lack of quorum, any closing comments? From the meeting?
I would just like to let everybody know that I will be out of town Thursday, Friday this week for the ACHP. Retreat or.
So